There are some other various ways we can use to classify proteinuria, and these ways we'll be looking at them in this lecture, and not in depth, okay, because on each of the criteria we're actually be making different videos on it. Okay, so here we are just here to just introduce you to the whole concept. Take this one, just write like one or two sentences on it, take the next one or two sentences, and so on and so forth. So everybody knows what proteinuria is, right? Proteinuria is when you have proteins in your urine. So proteins is passing somewhere to get into your urine, which is not supposed to be, right? Then the first definition or the first criteria for classifying proteinuria is the transient proteinuria. Now the transient proteinuria, here's something is transient. That means what? It's temporal, it's on emotion, it's on transit. It will go away. Do you understand? So transient proteinuria is for temporal excretion of proteins, and it can be caused by what? Strenuous activity, a high fever, exposure to cold, stress, and other conditions. Pregnant women may also excrete more proteins in their urine more than when they were not pregnant. Transient proteinuria does not involve underlying kidney disease. Okay, it requires no treatment. It's transient, it will go away. How about orthostatic proteinuria? Orthostatic proteinuria is more of like what? It's also known as a postural proteinuria. It's a condition where an abnormal large amount of protein is excreted in urine when the patient is upright. Do you understand? So one thing is, if you are trying to diagnose for this orthostatic proteinuria, if the patient lies down, the proteinuria will go away. Okay, the patient lies down, the proteinuria will go away. They also have overt proteinuria. Overt proteinuria is a condition where there is an excessive amount of what? Protein, which will be present in urine, and this is exceeding about what? 100 to 1000 milligrams per day. So literally, when they say something is overt, they simply means what? That thing is too obvious. Okay, they mean that that thing is very much more obvious, right? So I think that's it. We've done 3. Then talking about the persistent proteinuria, we said that this type of proteinuria is the most serious, and it happens in people with kidney disease and conditions which affect the kidneys. Something is persistent. That means what? The thing is just there. You do this test, you come another day, it's still there. Okay, persistent. So it occurs in people that have kidney disease or another conditions that affect the kidneys, like what? High blood pressure or diabetes. It also occurs if you have a condition that causes what? Overproduction of proteins in the body. Then there's micro what? Albuminuria. This is when the person has proteinuria, but you can't really, okay, you can't really see. Okay, you can't really see. See, you use the microscope to view it. Okay, microalbuminuria. Then glomerular or non-glomerular. Glomerular proteinuria is more like there's proteinuria and the cause is from the glomerulus. Let me say that filtration that occurs at the glomerulus, proteins is now passing through. Then non-glomerular is simply what? The cause is not from the glomerulus. Then isolated is when there's just proteinuria, there's no other disease condition attached. Then nephrotic or subnephrotic. Nephrotic is simply there's proteinuria and the cause is what? From the cause is from the nephrons. Okay, so this is just a rough video, making videos on each of those types of what? Proteinuria.